Very briefly, because I've got about one sentence to go.
The right honourable member for giving way. As a public health doctor, I am delighted to hear him speak so freely and openly and positively about all the great things this bill will bring. But I remain unclear whether the right honourable member will actually be voting in support of this generation-defining public health bill this evening.
Very grateful, and that will be dependent on whether this minister gives the promises I seek that he will withdraw a number of measures that they have added into the bill. And to the Secretary of State's point, I very much look forward, and I'm very grateful to my honourable friend, the member for Sleaford and North Hykeham, who will be taking this bill through committee on behalf of our front bench. And I know that she will look forward to, I hope, constructive and collaborative engagement with the Minister for Public Health. And I hope that he is able to offer reassurances when he gets up to the dispatch box in a few hours' time.
Dr Becky Cooper.
Thank you, Madam Deputy Speaker, and it is an absolute privilege to be able to take part in this debate today and to hear the broad consensus around this excellent bill across the House. We have come a long way since the 2004 White Paper proposed a smoking ban in almost all public places in England and Wales. Smoking on public transport, and as we've previously heard, and in workplaces, now feels inconceivable thanks to decades of work from campaigners and public health professionals, and thanks to bold action from government. As a public health consultant, I would like to pay special tribute to my public health colleagues who work so tirelessly in this area. From the seminal research in 1956 undertaken by Sir Richard Doll and team, which first established the link between smoking and lung cancer, something we take for granted today, through to the smoking cessation advisors who work daily to help people combat this destructive addiction. Mark Twain is reported to have said, "Quitting smoking is easy. I've done it thousands of times." In my career to date, I have been fortunate enough to undertake smoking cessation training, and I can testify to the incredible amount of hard work and sheer determination that both the quitter and the advisor put in to overcome the nicotine receptors that demand to be fed. This is an addiction, not a choice. So better by far to not start this destructive habit in the first place. Currently, every day, around 350 young adults still start smoking, and around 160 people are diagnosed with cancer caused by smoking. Smoking, as we've heard, is still the leading cause of premature death and disability in the UK, and is responsible for half the difference in healthy life expectancy between rich and poor. And we've heard other honourable members across this House talk about inequalities and how this will really contribute to reducing those appalling health inequalities in this country. So it is right that this bill will phase out the sale of tobacco and create a smoke-free generation. Already, fewer and fewer people smoke, and this legislation will increase that rate of decline. Increasing the age of sale by 1 year every year, we can expect to see smoking rates among 14 to 30-year-olds reach zero by 2050. And as a mum of 2 young sons myself, I greatly welcome that. A welcome to the increased powers to tackle vaping in this government's bill. Vaping can be an effective aid for adult smokers to quit, but much tougher measures, as we've heard again in this debate, are needed to regulate products designed to appeal to young people. As ASH, the Action Group on Smoking and Health, put it, vaping is an adult quitting aid, not a children's toy. The Chief Medical Officer also further underlines this by stating, if you smoke, vaping is much safer. If you don't smoke, don't vape. Marketing vapes to children is utterly unacceptable. This bill will give the government far greater control over the marketing and design of vapes and the flexibility to adjust regulations in the future if the market or evidence changes. And as smoking rates continue to decline, I will give way, absolutely.
Would the honourable member agree as well that's why it's important we control vending machine sales as well?
I thank the honourable member for that intervention, and I wholeheartedly agree. Vending machines are often forgotten, but it is incredibly important that we understand that sales and marketing use that in a way that we often don't understand. So thank you for that intervention. I will give way, yes.
But then we should also look at online sales. Lots of young people are actually purchasing products online. So what is the bill saying about that, if I can ask the Minister?
Thank you to the honourable member for that intervention. I don't disagree either. As I say, the bill will give the government far greater control over the marketing design of vapes and the flexibility to adjust regulations in the future. Life evolves outside of this chamber, and we need to be able to evolve with it flexibly. I will continue. Alongside the measures in this bill, this government has made important commitments to integrating smoking cessation into routine care and ensuring the most disadvantaged groups are not left behind as we move towards a smoke-free Britain. When I was undertaking my training in public health, a director of public health told me that our profession is where medicine meets politics. I'm not sure how he'd feel about me going into politics, but there we go, that's what he said. In this bill, I am delighted to see the evidence and data from my profession working in synergy with the policy development of this government to bring forward a bill that will allow our young people to enjoy healthier futures and to allow us all to live in a healthy environment. My thanks to all members across the House for their work on this, and I offer my wholehearted support to this bill.